Hello. I'd like to tell you the story of a cancer survivor. So I'll start with the definition of cancer survivor, which is a bit paraphrased. This is from the American Cancer Society and also the National Cancer Institute. And they say cancer survivor is anyone who's diagnosed with cancer and is still alive. So therefore, I'm a cancer survivor, as are many of you. So my story is about my breast cancer journey. I picked today to tell you this story because 9 years ago today, I had a 10 to 12 hour procedure colloquially known as a bilateral mastectomy. So let me just take you back. So in July of 2014, I woke up one day and I noticed that my right breast was kind of tender. And I'll mention that at that time, it had been 14 years since I had babies. I was not breastfeeding or doing any of those types of things that might cause your breast to be tender. So that was a little unusual. I did some Googling to see if there were any symptoms of like perimenopause or menopause that would make your breast feel like that, and I couldn't find anything. And over the course of the next couple days, my breast became so inflamed that I had to dig out an old bra that was a whole cup size larger than the one I typically wore because I couldn't fit into my existing bras. And I called my doctor and I was like, hey, is this a symptom? I've never seen this before. It's very uncomfortable. It's painful. It's red. It's inflamed. And they got me in right away. And, you know, when your doctor gives you that look like it's all under control, but it's really not under control, I could see by the way he was reacting and what he was saying that he was shook. And essentially, you know, with some more research, I came to find out that he believed, based on my symptomology, that I had inflammatory breast cancer, which is very difficult to survive. It's very aggressive, very quick, and by the time you see it, it's pretty far. So I had been for a mammogram. This was July. I had been for my regular yearly mammogram in May. I guess I'll also mention I was less than 45 at this time, so I was under the age group. The reason I was going for mammograms already was I had already had ovarian cancer, and they were checking. So he was like, you need to get in right away. And, I called, and the radiology place is like, you just came, you don't need one. We can get you in a month, or we can get you in a week. And he was like, oh no, you need to be in today or tomorrow. And he was calling he had his folks calling the radiology group, and we got in, and I went. And the summary here was that they basically said, oh, you have a mastitis, like an infection in your breast. You should be on antibiotics. That's what they told my doctor. They came in, they did all the things. They did they did most of the things. They did a mammogram and an ultrasound, and I stuck around. I was in the women's imaging room it had to be 2 or 3 hours. Like I did one, and then I did another, and then the radiologist came in, and then they did more, and it was just kind of going on. So anyway, long story longer, they insisted it was just a mastitis or an inflammation of the breast, and get on antibiotics. So I agreed. I guess I should mention concurrently with getting this appointment for imaging, I scheduled in with the breast surgeon, breast specialist, to have them, evaluate. And that appointment was within a week. I forget the timing exactly. It was like a Friday to a Thursday, or a Monday to a Thursday or Friday or something. I don't remember exactly. 9 years ago. But, and I was like, when my doctor called and said, they want you to be on antibiotic, and I said, fine, but I don't think that's it. I went to see the breast surgeon, who I liked a lot. Was not the breast surgeon. We had a kind of a relationship with another surgeon, and that's who I wanted to see. This was her partner, but in the end, I'm happy I got the surgeon I got. So keep listening. She was old. I don't know that she was older than me, but she was definitely had some set of experience. I'd say she'd been practicing for 5 to 10 years, and blah blah blah. But I went in and I was like, look, you're the professional, you're the doctor. I don't think this is right. And I told her a little bit about my ovarian cancer history and how it was found and how, and all that stuff. I just don't present typically. They're telling me it's an infection, but I don't think so. So the only thing I'm asking from you, Miss Doctor, is please be 100% sure when you send me away that I don't have breast cancer, because I'm not convinced in my heart, and I want you to be sure because you're the professional. And we kind of went down a path. So at that time, she's like, I can't really feel anything. The inflammation's so much. Take Advil, take the antibiotics, come back in a week or 2 weeks. I forget the exact timeline. I guess it was when the antibiotics course was done. The inflammation will be down enough that I can evaluate. So we did. We came back. She could still feel, it wasn't, the whole breast wasn't inflamed, but now I just had this kind of smushy piece of, I don't know what to call it. Breast tissue. It was almost like a sponge, like a fairly significant sized sponge at the bottom of my breast, that she could feel, I could feel. And she asked for permission to do what they call as needle biopsy. So they stick a needle and they pull material out. And I said, sure. And she really worked with me over the course of the next while. That biopsy came back as inconclusive. It basically said it was necrosis, like dead tissue, probably from an infection, was what it said. But, you know, she's like, okay, well, let's wait a couple more weeks and then see what's going on. So we waited a couple more weeks. She contacted me. We did a lot by phone versus in person. Is it bigger? Is it better? Is it the same? Same or a little worse? All right, I think the next thing we did was schedule an MRI. That took a little bit of pre-certs and all that, you know, American medical system stuff. We got the MRI. She made the decision at that time, although it was only the right breast that was impacted, to do a right and like a bilateral MRI, so she could like look at both breasts. So she called me after the results came back on that. She was sitting with the radiologist looking at the results, and she said, well, it doesn't look like cancer to us, but it doesn't look like anything we've ever seen before. And what she described was basically like a river system with tributaries, and all of the ductal system in my right breast was lit up. So it looked like it was just, you know, waterways. That's what they could see on the scan, but they did not see that on the left side. So again, she's like, well, it doesn't look like anything we've seen. It doesn't look like cancer, but we don't know what it is. And so then at that time, she recommended that we went in and did what they call an excisional biopsy, which is to have a surgery and cut out a piece of this suspicious breast tissue so they could send it for pathology. And so we did that. And now we're in mid-October. So on we're in mid-September. So on September 18th, she called us into her office to get the results. And the results were something called Ductal Carcinoma in Situ, which is essentially a breast cancer. Some people say it's stage 0, but it's cancer in the ductal system of the breast that has not left the breast. That is, to the best of their knowledge. And it's characterized differently than infiltrating or invasive ductal carcinoma. And what they could also tell us was that it was multifocal. So, you know, when you think about breast cancers, there's focal and multifocal. A focal would be a lump. That's, you know, what everyone characterizes, you know, breast self-exams. You can feel, you know, a piece, this yucky thing. It was not a piece. It was everywhere. So to put that in perspective, I forget the details. I might need to pick, maybe I can put those on screen for you. But they took out, I think it was 5 centimeter mass. That's what I think it is, but I'll look it up and I'll put it here on screen for you guys. They took out a 5 centimeter mass. I forget the exact dimensions, but I think I can find it for you. And they cut that into 20 separate slides, you know, for pathology to look at. And what they found was that every single slide had microscopic malignancy, which was fairly devastating, right? So what they're saying here is that it was everywhere in the breast, even though I could only feel that one spot. Everywhere in the ductal system had microscopic malignancy. And so her recommendation was for a single-sided mastectomy. There was no lump for us to go attack. We had to take out the whole breast. And so there was quite a bit of consideration over the course of the next few weeks, consultation with plastics and so forth. But at the end of the day, I made the decision to do a bilateral mastectomy. Part of that was because my presentation was so atypical. All the existing scans, non-invasive scans, I'll say, did not show the malignancy, right? They showed somewhat normal behavior. So how could we trust any of those for the left breast if we kept it? And so we proceeded, against the advice of the plastics doctor, to do a bilateral mastectomy with reconstruction. Now, the reconstruction, we'll talk about that another day. Let's talk about that another day. And that happened on October 9th, 2014. So that was my bilateral mastectomy story. And in the ensuing months, I recovered from that surgery. It was very difficult surgery to recover from. Because I had DCIS, the decision was made that I did not need any chemotherapy, and that, this course of action would leave me with only a 1% chance of any kind of reoccurrence of breast cancer. So it seemed very safe to make the choice to finish my treatment with surgery. And the surgery was not a cakewalk. It was difficult. So brings us to the current story, and you guys are somewhat familiar with that, because I think if you go back to my plan, you'll hear about that. But essentially, so that scan showed, and I think I'll link that up here, wherever that goes, to let you know. It basically showed that there was 5 millimeter mass that lit up and was suspicious enough that we should follow through. So here's where the story continues. I guess something I didn't mention to you was on that September 18th day when we went in to see my surgeon about the breast cancer. She said to me, "I'm so glad that you told me to stick with it and make sure I was 100% sure, because you didn't present like anybody I've seen before, and there was no reason for me to believe you had cancer besides your feeling, but I'm glad we stuck with it because this could have had a much worse outcome." So that's kind of a big deal, right? So let's fast forward. I'll share this, I'll link the video here for you guys. That's the video where I discussed my PET scan results. I think I talk a little bit about our conversation there as well, but basically when I talked to her, she said to me, "How do you feel? What do you think?" And at that time, I said to her, "Well, I've been telling my medical oncologist for a few months now that something doesn't feel right, but he's telling me my labs look good and the scans look good, so there's nothing to worry about. Just keep living." And she said, "Okay, well, the right thing for us to do is to pursue this, to do scans and maybe a biopsy. So let's go down that path. But hearing you say something doesn't feel right makes me go, So we did that for the next, I guess it had to be a month overall, between, I think we did 2 or 3 ultrasounds, a needle biopsy, and then an excisional biopsy, to get to the point where we found out definitively that I have invasive ductal carcinoma. Fortunately, it is not in the lymph nodes, but it is multifocal. So where the PET scan and all the ultrasounds only see this little teeny 5 or 6 millimeter blip, in reality, it looks as though most of the breast ductal system is got little teeny microscopic, not microscopic, I don't want to say that. So 2 or 3 millimeter blips of malignancy, which is kind of a big deal. So as you already know, the path forward is Neo-Adjuvant chemotherapy, which we're currently doing. I'm finished cycle 3. I'm going to have cycle 4 in a few weeks. And that is hopefully killing the cancer. And then there will be surgery to remove the breast entirely. And we could talk about that another time. But my comment here is, please be aware that nothing is 100%. That 1% could still be an issue. So a lot of people test for BRCA1 and 2. I'll mention that genetically, BRCA1 and 2, I am negative, as are many of my family members that have ductal carcinoma. But we are negative for that. In any case, I don't know that that's here nor there. The end story here is that, what is the end story, Jen? Get to it. Please be cautious. Please listen to your body. I think I gave this on a video a couple days ago. And find a doctor that listens to you. When we went back to see my surgeon this time after the excisional biopsy to find out what our plan was, now that we knew there was cancer in there, she told us that my case, changed the way that she handled patients forevermore. So for the last 9 years, yes, there's been a few people that had unnecessary procedures, but there were several people that their lives were saved because they didn't present the way the textbook said they should present, but there was enough of a doubt in her mind or the patient's mind that she kept on going. So that's kind of my, I think that's what I'd like you to get from my story. Please, please, please listen. Listen to your body and find doctors that listen to you. If your doctor's not listening, if you feel like you're getting medically gaslit, move on. Get a second opinion. It's your life. You count. Take care of you. Take care of your family. To me, the measure of success in this battle is finding your cancer early and fighting as hard as you can. And early you can only do when you listen to your body and when you find doctors who listen to you. So please do that. Love you. Thanks for listening to my story.